Hello, everyone. My name is Raquel Wallace, and I am the National Manager of Programs at the American Liver Foundation. I would like to welcome you to today's webinar, made possible by the generous support of Eisai and Bristol Myers Squibb. The American Liver Foundation is the nation's largest nonprofit serving people with liver disease. We provide a voice for patients with liver disease and their families through education, support, research, and advocacy. I would like to thank Sarah Russ, who will be sharing her expertise on today's webinar. While this webinar provides information that can be used for different chronic diseases, we will also highlight some navigation tools for many chronic liver diseases and transplantation. According to a survey conducted by the Association of Oncology Social Work, more than half of cancer patients report that healthcare costs and other financial issues negatively impact their focus on treatment and recovery. We can also see how the financial pressures may not help in healthy outcomes for other patients as well. Before we get into the content for today, let me just start with a few housekeeping items. On the upper right-hand corner of your screen, you should see a dialog box. If you don't, there is an orange arrow you can use to expand the window. From here, you can ask questions. You can ask questions at any time, and we will be answering them in the last 10 to 15 minutes of the webinar. We will get to as many questions as possible. We welcome your participation, so please do send questions in. I would now like to introduce Sarah Russ. Sarah Russ attended New York University, NYU, where she received her Master's of Social Work. She has been working in hospital or clinical social work for the past 6 years. She has been a part of the University of Miami Transplant Institute's liver team since 2017. Sara is a member of the Society for Transplant Social Workers and recently attended their conference in Colorado. Sara is not a financial expert, but she can help us navigate some of the most common systems which affect finances surrounding chronic diseases, including liver cancer, as we just observed Liver Cancer Awareness Month. She's a diligent and dedicated professional who is passionate about assisting, equipping, and empowering patients. Without any further ado, I now present our speaker for this webinar, Sarah Russ.
Hello, everyone. So just to reiterate, I am not any type of financial expert, but there are a lot of common tools we're going to just navigate and go over so that you have an idea. So we'll get started with some of the program objectives, what common issues do liver patients face, and any really end-stage organ failure patients, both financial and emotional. What programs are available, medical and non-medical assistance? How can someone access these resources? Who qualifies for these resources? Payment plans, insurance, and emotional moral support and further guidance. Financial disclosures on my end. I have not received any financial benefit from this webinar. So let's talk about end-stage organ failure, liver disease, and your livelihood. It's kind of an overview of everything we're going to be talking about. When you're facing a disease like end-stage liver disease, your income often suffers. That can be for a lot of reasons, but the most pertinent is more sick days because you're feeling poorly, a lot more doctor's appointments that are necessary to keep up with managing your disease and your symptoms, more depressive symptoms. It's very easy to feel down when you're not feeling well physically, and those tend to exacerbate how you feel and how functional you are, which can lead to more sick days. Often family members that can also be contributing to the household income may need to take time off to help you. And it's very difficult to feel like you're a burden to your friends and family members, and you need that emotional and financial support. And a lot of people don't want to continue to ask for help. So let's talk first about the practical stuff, offsetting costs. So you want to start with the least disruptive way of offsetting the cost to your family of leaving work, which is obviously sick time, vacation time. If you have any extended leave that your job offers, some jobs even will offer something called a PTO bank or a leave bank that maybe your coworkers can contribute if they feel so moved to contribute some of their leftover hours at the end of the year. When sick time is tapped out, be aware that FMLA, the Family Medical Leave Act, is available to anyone working full-time in a company over 50 employees. Now, this is a federal law, so it's something that you should have access to. And it's also something that's available to your immediate family members, legal spouse, children, cousins, parents, anybody that's willing to take care of you. There's also something called intermittent FMLA, because FMLA entitles you up to 3 months per calendar year, but you may not want or need to take all of that at one chunk. You can take it day by day, depending on how your employer sets that up. So be sure to ask if you can do intermittent FMLA if you have that available to you. It does require paperwork filled out by your team and your physician. So let us know as soon as you're aware if you need that paperwork filled out. FMLA does not entitle you to pay, but it does secure your job when you're ready to return. So it's one of those things that may offset a future cost, but doesn't necessarily get you paid right now. Supplements to FMLA. So you want to talk to your human resources department as soon as you know you're sick, just to get an idea of what benefits are available to you. A lot of people, when they do open enrollment, they might not really pay close attention to what they're saying yes or no to. So just check if you have short-term or long-term disability insurance through your employer. Usually that is 40 to 60% of your pay. It requires paperwork to be filled out, but it can cover you after your paid time off ends if you've been out for 2 or 3 weeks. All of them have a little bit of a different timeline depending on the company. Also, an indemnity insurance like an AFLAC plan is something that helps. If you have to go into the hospital unexpectedly, they can cover by giving you cash payouts of certain amounts for different reasons you're staying in the hospital. Now, if you already have these, great. Get all of the details of what you need to qualify for those different benefits. If you don't already have them and you've already been diagnosed, you want to make sure before you elect to start those the following year that they don't have pre-existing condition clauses, because it's not health insurance. They can still discriminate based on a pre-existing condition. So just make sure before you elect to get that you would qualify to get the benefits afterwards. This is important too for people who've been diagnosed with a genetic disorder that their family may have. You can go ahead and advise your family members about the genetic disorder and the fact that it may run in the family, and they could potentially elect to get their disability and indemnity insurances available through their employer to offset any cost for them in the future if they end up getting diagnosed with the same thing. And you can also check if your loved ones have a plan like this that covers you. If you didn't elect to do it, maybe your spouse did. So always ask. Fundraising. So we've all heard of GoFundMe, but there are a couple specific to medical fundraising. So Help Hope Live and National Foundation for Transplants have websites set up where you can do specific to medical fundraising. Now, a lot of patients don't want to do this. They don't want to reach out for help in this way, but we do have patients that have had a lot of success with this. The good thing about these two particular fundraising options is that they're charitable contributions, so they won't affect any federal or state benefits that you're receiving. They won't count as that kind of income. Also, anybody that donates to these would get a tax deduction based on their donation, and they only will pay towards your medical bills. So that kind of helps you budget and helps leave your money out of the medical bills equation if you can help it. So there's some advantages to doing some fundraising. The patients that I've had that have, gone ahead and done it, they were very pleasantly surprised that a lot of friends and family members, coworkers wanted to help but didn't really know how else they could in the situation, but felt that they could give $5, $10 here or there, which ended up adding up to a lot of extra cash for co-pays and things like that. Disability benefits, let's kind of go back to that. So the two types, we already touched on the private disability insurance. Remember, it usually requires paperwork by your doctors. It pays anywhere from 40 to 60% of your income, depending on your specific plan. And you got to check with your work to see if you're enrolled in this already or not, or request an application from an appropriate company. And then the other type of disability is Social Security disability. You must begin your application yourself. I suggest going to the local Social Security office. Yes, it's a pain. It's a bit like the DMV. It's a big bureaucratic office. But if you speak to someone in person, you'll tend to get more of your questions answered. You'll also have a point person. If that person happens to have a phone number extension, you will have someone you can directly follow up with, which is extremely beneficial. Social Security is a bit of a bear. Your eligibility for disability depends on how many quarters you've worked. So if you haven't been working much in the last several years, or you worked under the table and you haven't quote unquote put into the system, you may not be eligible. Social Security can take 90 days to up to 6 months to make a final determination. So it is something that is a timely thing. If you apply today, you might not find out till February if or when they've accepted or denied your application. Social Security will request your records directly. So another thing I advise, if you know you're going in person to see someone to apply, bring the phone numbers and fax numbers to your institution's medical records department. If you have those on hand and you specify that to the person you're applying with, it's a lot easier for them to go ahead and send those requests out right away. And when you call to follow up, you can just say, hey, these are the institutions I gave you numbers for. Have they been contacted? And you can also follow up with your records departments directly to see if they've sent out those records for you. So often the amount of time that you've been out of work is a factor. So if you've only been out for 3 days, but you don't have any paid time off, you may not qualify quite yet for disability. So sometimes they say, okay, apply again when you have been out of work for longer, but be aware that you do have a limited amount of times you're allowed to apply for Social Security disability in your lifetime. So if you are denied Social Security disability, but you believe based on what your physicians are saying that you should be accepted, it's important that you begin by appealing the denial. Don't start a new application quite yet. You can appeal the denial through a lawyer, but there's also a company called Allsup. They take a flat fee, and they also do a free over-the-phone assessment with you to see if you're likely to get that appeal approved. So it's something where you can use that free phone call to get an idea of whether it's worth it to appeal. So if you have a fee, it's usually after they've awarded you the disability, and lawyers usually charge a percentage of that and take it once they've gotten it awarded to you. Or Allsup has a flat fee that they, again, would only take out once you got awarded the disability. So end-stage liver disease and other end-stage organ failure diseases are not necessarily considered a permanent disability per Social Security, unlike some other disabilities. Meaning that if you get a transplant, disability and any attached medical insurances end. For liver disease, that tends to be 6 to 12 months after the transplant, which does give you time to recover and get insured in another way. I believe for end-stage renal disease, there is a 3-year time period, and then disability ends. You want to make sure that you check with your team if they have any medical knowledge of what diagnosis and when, but also talk directly to Social Security about what diagnosis you're under and what that entails as far as a timeline. your physicians cannot directly appeal this decision on your behalf. So as much as we can agree with your findings of not being able to work, and the physicians may be telling you you really don't need to be going to work right now, they can't actually change Social Security's plan. That's only through an appeal through a lawyer. All right. So Social Security disability also comes with attached insurances. Social Security disability, when awarded, includes Medicaid for the first 2 years that you're under disability. Some diagnoses do get Medicare right away, but it's not all diagnoses. So most of them you're going to get Medicaid for the first 2 years. There is a type of Medicaid called share of cost. What that entails is, in order to offset some of the Medicaid costs for the state, what they'll do is they'll give you a deductible each month. Let's say your deductible is $1,200 each month. If your medical bills equal $1,200 or more, the Medicaid will take care of all of those bills and anything beyond that. If your bills equal $1,199, you are responsible for all of those costs. So for people that are going through transplant evaluation or very intensive, other types of surgeries like liver resection or ablation, things like that that are very expensive, share of cost can still work out. If you're just going to your local hepatologist and you're only on a couple of medications that don't equal your deductible, share of cost can be difficult, and that's when you want to look into things like fundraising, community action agencies, and other things that we'll talk about a little bit later. After 2 years of being on disability, you will be granted Medicare as well. But be aware that it covers 80% of your medical bills, and you will need, especially if you're going for transplant, you'll need some sort of Medicaid, Part D plan, Medicare HMO, or supplement. And you can talk to an insurance agent about what is available in your area. Just to give you some reasoning behind why you'll want that is a rough estimate, and this is not exact numbers and it varies from place to place a little bit, but it's about $500,000 for the hospitalization for a liver transplant, for the surgery and that hospital stay alone. That doesn't include any of the pre-workup, that doesn't include any of the post-op care. And 20% of that equals $100,000. And I don't know very many people that have $100,000 even saved for retirement. So this is what we mean when we say you need a supplement. It sometimes seems expensive to purchase a supplement if there's a monthly premium, but overall it's going to save you quite a bit out of pocket over time. Also, Medicare doesn't cover prescriptions unless you have an HMO or Part D, Medicaid, or supplement. You're not going to have coverage for those medications that are going to help maintain your transplanted organ. So just make sure that you're looking into all of those options. I would start by applying to Medicaid, and then, start with what's the least expensive, what's the least difficult for you. And if you're denied, then move to the next option. So what if we have private insurance? A lot of us do. The thing to know about private insurances, and even some Medicaid and Medicare HMOs, many of them have small benefits here and there that can help offset costs, but you have to look for them. The insurance isn't necessarily going to reach out to you and say, hey, here's the money. That would be nice, but they don't always do that. Some of them do. But a lot of them do have a case manager available to you. If you're going for transplant, some of them have a specific transplant case manager. These people can help walk you through how to get referrals faster, who are your preferred providers so that the copays may be a little smaller, help you get the necessary paperwork to get reimbursement options, and help you get pre-authorizations more quickly if you need them to get the care that you need. So a case manager is someone to definitely pinpoint at your insurance company. Then go to your primary care. I'm sure if you've got complicated health issues, you're very used to going to your specialist for most of your care. But under private insurance, a lot of the time, going to your primary care is necessary at least once per year to help get you the referrals that you need to keep all of your specialists covered. Also, we're looking for very specific things. So if your primary care is looking at the overall bigger picture as well, it just helps round out your medical care. And if they find anything else, they can refer you to another specialist. Okay. So seeking out those benefits, request a benefits booklet to get an idea of what's included. This is really important because you need to know what your max out-of-pocket expenses are going to be, what your copays are, what your deductibles are for each admission, things like that. It's also important to note that for a max out-of-pocket expense, if you are going for a surgery, a surgical intervention, or transplant, a lot of times you will meet that max out of pocket. So that can help you if you are putting a fundraising page together, kind of estimate, okay, this is going to be what I'm going to need for this year. And you can post it up there for people to see to get an idea of why you're asking for a certain amount, especially if you feel uncomfortable about it, just to kind of put some real information out there for people. Sometimes it's necessary if a specialist is far from you to travel. We have a lot of people that relocate temporarily to stay with us right after transplant. And a lot of insurances and a lot of Medicaids even have gas mileage reimbursement, hotel stay, and even some have food stipends if they know you're staying for a number of days in a different area. So getting an idea of how to apply for those and if you qualify. A lot of times there's a rule about you have to be at least over 25 or over 50 miles away from the center. But if you have those and you have those papers printed out with you already, we'll gladly sign anything for you to make this a little easier on you. If you're a post-transplant patient or if you're immunosuppressed for any other reason, just make sure that if gas mileage is a option that you choose that over an insurance-sponsored transportation bus of some kind, because we don't know who was in that transportation bus beforehand. Because if it was somebody with a bad infection and that's why they needed to come, being immunosuppressed, you want to try to take the private transportation option. Pre-transplant, if you're not immunosuppressed for some reason, then definitely you can take the bus or the van, and that helps to keep your loved ones from having to come to every single appointment, especially if you're not feeling well enough to drive yourself. Private insurances are also one of those things that make you eligible for copay reduction cards. Pretty much any medication nowadays, especially if it's still under patent, so it's a brand name, come with copay reduction cards. A lot of times you have to be in a certain income range, but sometimes you don't. Sometimes they just want to, promote their product, so they're willing to help you pay your copay. You can just Google the name of your medication and copay card, and it should come up. Usually it's a quick 2 to 3 minute survey, and then they mail you a card to get it reduced or even $0 sometimes. Also, the website needymeds.org it's kind of a compendium of all of the different kinds of medications that you could need and what has copay cards or assistance programs. So you can always use that to find what you need. Okay. Private insurance and COBRA. So we talked about having to separate from your job if you have to. That does happen sometimes due to illness. Most companies, depending on the size of the company, are required to offer you something called COBRA, which allows you to purchase your current plan at the employer rate for up to 18 months. Now, a lot of people see the COBRA bill and think it's very expensive, and realistically, $500 to $600 a month is expensive for most people. However, depending on your employer's insurance plan, particularly if you have very low or no copays, they cover most of your medications, they cover hospitalizations with a low deductible, likely much better than any kind of private insurance you could purchase. If you are offered COBRA also, you won't qualify for a special enrollment in the Affordable Care Act, or what people call Obamacare. However, if your employer doesn't have a COBRA option, or doesn't have a sponsored plan and you're terminated, you may qualify for a special enrollment period for the Affordable Care Act to obtain coverage. So just be aware that if your company isn't offering COBRA, log on to that healthcare.gov website, which we'll discuss in a moment, and enter that information so that you can qualify for the special enrollment period for life events. After your 18-month period of COBRA, you must make plans for your own coverage. So you can do Social Security disability if that's something that you're applying for. You can apply for Medicaid in your state. You can explore the Affordable Care Act. You can seek employment with a new employer if maybe there's an option for you to work remotely or something that works better with your condition, or private pay insurance. I would start with the ones that maybe are a little less expensive and see what you're eligible for and go from there. But also know, because things like Social Security and Medicaid take time to apply to, you'll want to start making plans to do that several months before your 18 months runs out. You can start maybe 3 to 4 months out to give yourself time so you have as little lapse as possible. Copays. So regardless of your insurance, Medicare, Medicaid, private insurance, it is likely you will have copays. A copay is basically you're taking responsibility for some of your medical care. And those copays will vary, but doctors' offices and transplant centers often don't have authorization to pay these bills for you. So that's why it's important to kind of be proactive and look for other ways to offset these costs. Every once in a while, or depending on your institution, they may have some charity funds available. Those usually are based on your income. It can range from the poverty line to 200% of the poverty line, and sometimes generously centers will grant 400% of the poverty line. However, they don't always have funding. A lot of that kind of funding is limited, and once enough patients have requested it, they don't have any additional funding. So just be prepared that they may not have that option for you. That being said, if you talk to your center or your specialist about payment plans available prior to needing a payment plan, they'll be able to work with you easier. So if you know your copay is $100 and that's really hard for you to pay, and you have another appointment in 2 months, you can call the center and ask, hey, can I do a payment plan leading up to my appointment of $20 every 2 weeks and then pay the final, balance when I get there? If you're proactive about it, you can make it a little easier on yourself. Also, if you get that hospital bill in the mail and you cannot pay the full amount, still call the billing office right away, make some sort of small good faith payment, and ask for a payment plan. You want to avoid going into collections over a hospital bill. And if you make a payment plan, most hospitals will do that for you. Skipping visits and medications is dangerous, though, especially for post-transplant patients. So make sure you ask ahead of time if there's some other way to work it out before you decide to skip any appointments, labs, or medications. So let's talk about ACA Obamacare. Because of this law, you're able to apply for tax breaks for your insurance premiums available through healthcare.gov. And it is open enrollment, November 1st through December 15th, and that coverage begins on January 1st. So go ahead and log in at your earliest convenience if this is something you're needing. When you're comparing plans, make sure you compare everything. So not just the monthly premium is something that we usually think about a lot, but you also need to see what drugs it covers, what are the copays, deductibles, max out-of-pocket expenses, and that way, if you're adding up everything that you will owe, you'll have a much clearer sense of what that is. How it works is the government looks at your last year's taxes and decides on what kind of subsidy you will get. They'll give you a number per month. You can get the monthly deductible reduced by that number every month, or you can choose to get it in a lump sum at the end of the year, although it's probably much better for budgeting purposes to just do it month by month. Make sure you talk to your specialists and transplant centers while you're going through this process to make sure the doctors that you are wanting to see are on the insurance plan that you choose. If you stop paying the monthly premium for these insurances, they will terminate. So make sure that this bill is a priority for you if this is how you're obtaining your insurance. Also, at this time, this law includes some protections for individuals with pre-existing conditions. So it's something you might want to keep your tabs on with the, political changes, just to see if it's ever repealed or if changed. Make sure you understand if any of those protections are there or not there so that you can plan accordingly. So foundations and charities, because some of this stuff you're not going to be eligible for, or maybe you don't qualify for financially. There's other foundations out there that can help. Depending on your diagnosis and your level of income, there might be financial resources from charities and foundations. Now, there might be some local ones as well, and I'll talk about a few in the South Florida area. But there are also some national ones. So HealthWell Foundation, TAN Foundation, and Patient Advocate Foundation. All of these are big websites that list a lot of financial resources based on your specific diagnosis. So you can search through these websites. Some of them also have grants that they can offer if you're not in one of their categories. And you can ask your medical team to help you fill out the paperwork for grants if you don't fall into one of those already outlined buckets. So these websites are worth a look. Also, counties in Florida and most counties across the country have a system where there's a designated hospital in your area or designated healthcare system that provides charity care for low-income uninsured patients. So for our area, we're the community hospital, Jackson and Miami-Dade, and we have kind of our own little charity/insurance program. In Broward County, which is our neighbor, we have Broward General and Broward Memorial in Broward County. Lakeside and Good Samaritan help out in West Palm Beach County. So any of those are available for you. And if you're curious about what the county hospital is in your area, you can Google charity care or financial assistance healthcare and the name of your county and state to see if something's available, or you can see if you can go to a local community center and talk to a case manager about who you can hook up with to get your basic healthcare needs met, like immunizations, regular checkups, and things like this. Hospitals are also often able to arrange payment plans. Like I said, you want to avoid collections and negative credit reporting because you want to have all of those resources available to you. Having good credit will help you build back up after you recover from your illness. So there's other bills, right, that we all pay that have nothing to do with medical expenses, but if you have a lot of medical expenses, they can end up getting affected. So FPL, which is Florida Power and Light, has applications available and payment plans for light bills. Like I said, in other areas of the country, other utility companies usually have these programs available. So check to see if you're eligible for a hardship to get that bill extended, or even maybe they have a grant opportunity available. Also, there's something called a community action agency, and almost every county in the country should have one of these. It's similar to how I said some of the centers and specialists might have funds available, but depending on how many people request those bills to be helped with, they may run out of money. Most of them start taking applications at the beginning of each month. So it would be good for you to kind of look up what's available in your area before you need it, because then you can time your request towards the beginning of a month if you know that that's going to be a hard month for you, and be more likely to get that bill accepted and helped with. So take a look at what's available, whether you need it right now or not. Also, local food banks are available, and I have a list of all of these resources attached for after the webinar, but you want to look because there are food banks across the country, And if it comes down to your last $20 and you need your immunosuppressant, we want you to be able to get the immunosuppressant first and get food where you can elsewhere. So a lot of local food banks will have hot meals and or non-perishable items that you can quote unquote grocery shop for on a regular basis if you need it. So check out all those resources in your area. Get creative if you need to so that you're able to afford everything that you need to be healthy afterwards. The goal of transplant is to get you back to regular life, and the goal of managing most of these diseases in different ways with different treatments is to get you to where you have a good quality of life. But without having some of these resources, you might not feel that your quality of life is that great. So this is the time, an end-stage organ disease is serious, and this is the time that you will want to ask for help, and you will want to be open to accepting those resources. And a lot of people feel like they don't want to be a burden. And there's a sense of pride in not wanting to be the type of person that needs a resource like this. It's understandable. And it's understandable that people don't want to burden their family members asking for money, time, vacation, and other valuable items. And I want to point out that having pride and having tenacity that you're going to get through it no matter what are good things. We just don't want it to kind of skew into something that doesn't serve you by keeping you from asking for help. Their pride is a necessary thing if you're going to get through a major illness like this. So we don't want you to lose that, but we want you to reframe how you think about it. A major illness is something that you're going to need all that pride and tenacity to get through. You don't want to lose it on something silly. So you want to have friends and family that are available to you and willing to help keep that strong for you so that you can get through the illness. And starting with your close friends and family is easiest, and letting them know what's happening medically and what all of your care is going to entail is very important, because if they're going to be there for you, they deserve the chance to be well prepared for what you're going to go through. So let's plan for the long term. It's a difficult thing to go through a chronic illness. It's a difficult thing to go through transplant. It requires physical, financial, and moral support. And most transplant centers, even if you're going through medical management, we want your friends and family there to help you out with some of this. And starting to talk to them as soon as you can is very important. And being honest and upfront. I think sometimes we don't want to scare off the people that are closest to us. And that's fair. But if your friends and family have the opportunity to make peace with this, a lot of them want to be there in a way that's actually helpful to you. So let them make peace with it, and let them have the opportunity to ask questions to your team if they're going to be involved in your care. And sometimes your physician, your social worker, a therapist can help you have this conversation with your loved one as a group. That will take some of the pressure off of you as well. Or you can even have a social worker or a therapist role play talking one-on-one with your loved one about what you're going through, if that's going to be a difficult conversation for you. Plan it out, see what you're going to say, see how you feel about it, process those feelings with a social worker or therapist so that you can feel comfortable when you do have that conversation. And we do want you to have your primary caregiver with you for major appointments. It also kind of helps ease strain for the caregiver, seeing what exactly the doctor is saying and being able to ask questions themselves. Sometimes when things get lost in translation between you and the doctor, it can add to frustration and tension between you and your caregiver, and we want to mitigate as much of that as possible. And family and your caregivers often need moral support as well. This is totally normal. It's just like it's stressful to be a parent. It's stressful to care for a friend or a family member, even if you love them. So we often compare this to putting your own mask on first, like in an airplane. and then help others. So primary caregivers and secondary caregivers should make time and space to get emotional support. However you do that, a therapist or a support group is highly recommended. You can do other types of self-care things, which is always a great supplement, but talk to someone who can support you so that you can process your feelings without feeling frustrated in the moment when you're actually doing your caretaking with your loved one. And sometimes your caregiver is your spouse, which can strain the romantic part of your relationship. And it's recommended that you guys do therapy or maybe talk to other couples that have been through it before, just to kind of get the sense that you're not alone. It is normal, and you're going to have a temporary loss of that romantic and partnership interest so that you guys can put getting well at the forefront of your minds. Don't feel ashamed for reaching out for support if you're the caretaker as well. I always recommend finding a local support group. I have some listed here for South Florida, but American Liver Foundation, Society for Transplant Social Workers, many of these organizations have on their websites resources for support groups. And they're really helpful to a lot of patients just to normalize what you're going through and give you point people that you feel you can connect with on a level. Sure, your doctors, your team, we all know in a practical way what happens, but if we haven't been through transplant, it's just going to be different coming from us. So I really recommend seeking out a support group in your area and attending at least a couple times just to get that additional support. And you might also find a lot of practical information, different creative things that other patients have done in order to feel more financially stable prior to transplant. So it's something that can benefit you in a lot of ways. So that's kind of the end of what I have prepared for you, but it's a lot of information, so I want to leave plenty of time for questions, depending on what anyone has thought of during the presentation.
Thank you very much, Sarah. So now we're just going to read some of the questions. There have been a lot of questions in terms of if we can record this. This presentation is being recorded, so it will be available on our website. So if you would like to look back on anything and refer to this presentation, you always can once this webinar is complete. Also, the next question that we have is, are there any suggestions for self-employed patients? So I guess with that question, the person wants to know what options are available if that person is self-employed.
Okay. So self-employment is one of these that's a little tougher, right? Because you don't have that employee-sponsored plan. It's highly recommended that you look into Obamacare during open enrollment. You can privately purchase insurance. However, it's going to be much more expensive. If you make a decent amount of money, and by decent, I mean it doesn't even have to really be that much. Like I said, 200 to 400% of the poverty level is usually what qualifies you for charities, which is not a very big income. I think 400% of the poverty level is something around $40,000, maybe $48,000. I'm not sure. But it's something in that range. So if you make over that amount of money, you may not qualify for any discounts for Obamacare. So for you, you'd be looking at private pay insurance. However, if you put a lot of your money back into your business and you're self-employed, and you put that information on your taxes so that your net income that you're actually paying yourself is not very large, you may. So depending on, it's always worth a shot looking into Obamacare, because it really depends on what you're putting in your own pocket versus what you're putting back into your company. It's worth a shot. Otherwise, looking into private insurances is really the biggest option. And private insurance is expensive out of the pocket, but it will offset a lot of costs in the long run, because likely it will cover a lot more than you're paying out. The other thing about having insurance versus going without is that even though a lot of places do take cash pay, some places and some specific really expensive exams, depending on what hospital you're getting, they might not take you as an appointment if you don't either pay up front or have an insurance plan. So it may be worthwhile just to have a better time getting into your doctor's appointments to have that insurance.
Awesome. Thanks, Sarah. The next question is, do you have to work for a company for over a year in order to qualify for FMLA?
Yes, that is true. Talk to your employer if it's been less than a year, because some employers grant it as like a courtesy. They don't have to. You need to be having worked for a year to qualify under the law. But some employers, especially if they know you do good work and they value you as an employee, will do an extension. And there are some employers even that will do an extension beyond the 3 months. So if you happen to work for someone that has really good benefits, then it's worth asking if they'll extend that to you as a courtesy.
Thanks, Sarah. So there's a question in terms of a specific number for a transplant. What does the $500,000 cover exactly of the transplant? Does this include the cost of the new liver? Also, have you heard of anyone having a live liver donor? If so, how risky is that? Yeah.
So I'll start with the first question. That's a rough estimate based on our center. The liver itself doesn't actually cost money. The things that cost money are the donor surgery, the cost it takes to procure the actual organ donor, the cost it takes to do the surgery of putting the organ in, and then the aftercare during the hospital stay. And that's going to vary from place to place a little bit. It usually does not cover anything before you get listed. It doesn't usually cover any of your appointments after, but it is an estimate, and it will vary depending on, what center you're at. And you can talk to your financial coordinators at your center about what the actual estimate for each place is, so you have a clearer idea of what that money is like. Now, that being said, if you have Medicare and a supplemental insurance, the likelihood that you will see very much of that cost at all is low. So that's why it's so important to get those extra plans. Now, living liver donor. It is a thing. We do have a program here at Miami Transplant Institute. And you would really need to speak to a physician about the risks and benefits of that type of surgery. But it is something that our center and other centers have been doing. So it's worth looking into if you have a donor.
Thanks, Sarah. We also have 2 questions on termination of SSDI. The first question is, what is the notification process to the patient when someone's SSDI is being terminated after transplant? Is it a letter? Is there also a chance to appeal?
It's usually a letter, and it is a big bureaucracy, so you might only get it maybe 30 days ahead of time. So you're not going to get a lot of warning. That's why I like to tell people about that timeline ahead of time, so you can be making plans in your head before they send you that letter. There is the opportunity to appeal. However, if you've gotten a transplant and the point of a transplant is to go back to work, most of the time that appeal will also get denied. We also recently had someone who appealed, and it was still for end-stage liver disease, which technically she did not have anymore due to transplant. This is just an example. It doesn't mean it would happen to you, but later on, they reversed the decision of accepting her appeal, and she had to pay back the money that she got after the appeal. So just be very aware that that specific diagnosis does not qualify you for permanent disability, and have that mindset. If you have other medical conditions that are causing you not to be able to work, in that case, absolutely appeal the decision and give them the new information. But it's important for you to act as if they will not give you the disability afterwards, because if you have a backup plan in place, you're much better off because the chances of them extending it are pretty slim for that specific diagnosis.
All right, and the second question for SSDI is the termination of SSDI after transplant based solely on getting the transplant or based off the success of the transplant?
Yes, that the timeline that they have set out is specifically based on getting the transplant. However, if you have complications or you reject right away and go back into end-stage liver disease or end-stage renal disease, then you can appeal that decision with the medical information like you did in the beginning and get those records offices numbers to them and let them see when you're getting your testing at your center, if it's showing, rejection and you're going into liver failure again, that we can get that information to them. So basically, if the liver fails right away, yes, you can go back on disability for the same diagnosis, and we have had patients that have had to do that. So if you're going back into liver failure, hopefully that's not the case, but if that does happen, yes, that is something you can appeal for.
Thanks, Sarah. We have one more question, and this is pretty much in regards to a person's personal story. So they qualified for Social Security disability. However, it led to Medicaid spend down. So I guess the person would like to know what would be the next steps, because sometimes there's an issue in terms of billing, with the hospital wanting to pay upfront, and then after that, the person really wouldn't be able to be scheduled for certain things.
Yes, that sounds like what we call sheriff costs in Florida. So now it's different from state to state, so this might be helpful advice, it might not, but I'm going to go ahead and give you the advice that I give my patients for Medicaid share of costs. We ask that they all get their medications refilled on the first of every month, and don't do a 90-day supply. That way it's separate each month, and try to schedule, some of your appointments later on in the month. Now, if you're fresh out of transplant and you have, $5,000 worth of meds, and they have 10 days of those bills going to Medicaid before you go to your appointment, you're much more likely that, we call it, your Medicaid has opened, quote unquote, and then they would be able to bill through Medicaid for your appointment. So some of it has to do with timing throughout the month. Some people actively, and our finance coordinators are lovely in that they do help the Medicaid share of cost patients and helping to send some of those off as quickly as possible, some of those bills to Medicaid, so that they see that you're meeting that deductible sooner. You could see if there's a financial coordinator at your center or with your specialist that can help you send off those bills quickly to Medicaid, or get you the contact information of where you can send the bills directly. And ideally, you could get a bill at the time that you're going in for each appointment and send them off the same day. If you're able to stop by like a Kinko's or anything that has like a fax machine, and just send it right then. Now that's a lot of proactive activity, but it does tend to help. So try to see if you can get it set up where your prescriptions are coming through very early, and some of your more expensive appointments and labs and things hit at the end of the month, so that they can go ahead and bill Medicaid. That's based on Florida, so if it's a different state, they may have a slightly different system. It may be worthwhile to talk to someone at your Medicaid office to see if there's any other specifics that could help make it work for you.
Thank you. And we actually have just one more question. Another one just came in. How soon could your body reject the new liver?
That's really a medical question. that I don't feel qualified to answer. um, hopefully never, but that's you're going to have to talk to your specialist and figure out if there's any medical factors you have. It's different for each person.
Exactly so. Rejection of the liver can happen at any point, but of course they try their absolute best to ensure that your body doesn't reject the liver, but ultimately definitely contacting and consulting with your healthcare provider. All right. Once again, Sarah, thank you for your time and your love for sharing this needed information. Many of the attendees have vocalized their need for this type of information, and they truly appreciate you as well. So thank you.
Well, I appreciate you guys all attending, and it was an honor to be with you guys today. Happy to give any information. There is a little resource sheet. Some of the information is geared more towards South Florida, but some of them have the national information for the different federal and national programs that I mentioned today.
Great. Thank you for that. And as I mentioned, this recording will be available once the webinar ends, and the resource sheet will also be emailed to the email that you provided when you registered for this webinar, so you'll also have that as a document as well. All right. Thank you to Eisai and Bristol Myers Squibb for supporting this webinar. And now I will bring this webinar to a close, but first, on the behalf of ALF, thank you to everyone for joining and participating today. Have a great day and a wonderful Thanksgiving when it comes. Have a great day, everyone.